Over half of you will have some form of periodontal disease by the time that you are 30 years old. My perspective is that although there are many factors that contribute towards the disease, knowledge is a good step towards prevention. The best thing you can do for your health is to be knowledgeable, to know what your body is doing and what you are doing to it. Today you will gain some of that knowledge to use for your own well-being. Today's presentation will help you to understand the seriousness of periodontal disease, help you understand the importance of regular professional maintenance of your teeth by a dental hygienist, and inspire you to increase your quality of home care to prolong the life of your teeth. I will introduce you to periodontal disease and where it comes from, the common risk factors and side effects of the disease, and discuss prevention methods. Periodontal disease, or perio for short, begins as gingivitis, which is caused by the buildup of plaque by poor dental hygiene. With gingivitis, the gums become red and inflamed and commonly bleed to the touch. Without care and cleaning, gingivitis progresses to periodontitis, where the supporting gum tissues around the tooth begin to pull away and are destroyed. Bone loss is also common and is irreversible. Over time, so much tissue and bone is lost that the affected teeth become loose and will eventually fall out or need extracted. Perio is most commonly found in adults, with about half of Americans over 30 presenting with some form of the disease. After age 65, that number increases to 70%. According to the American Academy of Periodontology, perio is more common in men than women, and in the United States, is most common in individuals with a Mexican-American heritage. Not surprisingly, those who smoke also have a higher percentage of the disease. Individuals with an education less than high school, as well as those living below the federal poverty line, have also shown high numbers of cases. There have been many health problems and risks linked to perio. One of the more alarming links is the possible association of perio with heart disease and stroke. There are many studies that show the link between the inflammation and bacteria present with periodontal disease and an increase in heart conditions. Many cardiologists recommend that patients with a history of heart conditions take an antibiotic before dental procedures because of the inevitable bleeding and stirring up of bacteria that could enter the bloodstream. Perio and diabetes have also been linked together. Many doctors believe that perio is a complication of diabetes, especially in individuals that don't have good control of their diabetes. In many cases, perio makes controlling diabetes even more difficult because it can cause an increase in blood sugar levels. Although more studies need to be done for conclusive answers, there are already links shown between pregnant women with perio and an increase in pregnancy complications. These complications may include early delivery of the baby or a low birth rate. As the evidence builds showing just how bad perio is for our health as a whole, it becomes more important to be educated in prevention. Prevention starts with home care. This includes brushing your teeth and your tongue, flossing at least once a day, and rinsing with a mouthwash. Being aware of your risk factors is also important, such as being predisposed to heart disease or being a long-time smoker. Having regular cleanings done by a professional registered dental hygienist is also an important step in prevention. Hygienists are trained to spot gingivitis and perio and can help with home care technique. If your dentist or hygienist says that you have perio, only getting treatment from them will help you slow the disease's destruction. Also, help your loved ones in their prevention. Encourage your elders to get checked during their dental visits, and teach your young ones good habits early on. Knowledge is a good first step towards prevention. Please help yourselves be healthier, educate others for their health, and please discuss any concerns with a dental professional. You won't regret extending the lifespan of your natural teeth while increasing your systemic health and your quality of life. Half of you will have some form of perio by age of 30, so please use the knowledge you gained today to lower that number.